Welcome, guys. You might know me. My name is Veronica. I am the New Zealand Clinical Advisor for Jobskin, and my colleague Rosemary is based in Western Australia, but helps to cover the entire great nation of Australia. Rosemary usually runs these short and sweet series, and unfortunately, she has been a bit busy recently. Her daughter is graduating, her other daughter's getting married. So we've been very lucky because she has recorded today's session for us. So what I'm going to do is I'm going to turn on the recording. We'll let it play through, and then we'll have some time at the end to be able to have any discussion or questions if you guys would like to do that. All right, so just give me a moment and I will share my screen and my audio. And Adam, you'll let me know if I don't hit the mark on that. All right, thanks, guys.
Is there meant to be audio now?
Yes. Okay, hang on a minute. I'm gonna get this. Give me a second. Oh, here we go. No.
I think you have to share the screen.
Yep. Can you see that?
Yep. So we can share that. You can see the screen. Yep.
For people who are
Yes.
wearing compression garments. So what are we going to look at today? I feel like what we're covering is not rocket science, but I do think that it's very helpful for us to be reminded of these sorts of things, because if we're aware of what impacts people's ability to comply with or adhere to what we're recommending, then we are much better in the ways that we factor that compliance into the prescription of the garments that we're providing for our patients or clients. So what are the things that impact compliance? Well, I think the first and probably the most obvious is our patients' engagement with the whole process, that they understand the purpose for wearing compression. When we are asking people to wear compression, whether it's during the day, in the case of a lot of lymphedema type conditions, lymphedema-related conditions, or for burns and scarring where we're asking them to wear them 23 hours a day, they need to understand why, what it's going to achieve, how quickly it's going to achieve it, whether this is long-term, whether this is short-term, whether it's maintenance, whether it's active treatment. Because as we all know, again, not rocket science, not telling you anything you don't know. When people understand, we've got a much better shot at them adhering to what we're recommending. The other things that affect patients' ability to comply are whether they feel that they've had any input into the garment choice or whether it's just been imposed on them, how comfortable they feel when they're wearing it, whether they're able to do things, whether they're able to live while they're wearing their garment, whether they're able to work or how work responds to them wearing the garment, their personal preferences, whether it suits their lifestyle beyond work, whether they can get the garment on and off, and particularly for toileting when there may be a greater urgency to take the garments off in a timely manner, personal hygiene, and then simple things like the garment design and colour choice. So I'm going to look at each of those one by one, or perhaps slightly grouped, a couple of them. But first, when we look at the engagement of our patients with this process, can I just highlight the fact this is not a literature review. There is patchy number of articles that do consider what what affects compliance or adherence, and also specifically to do with pressure garments, and also ways to engage that. That's not the purpose of today's webinar, but if you want to look further, there are a handful of articles around. And I kind of feel like engagement and patients understanding the purpose is therapeutic effectiveness 101. We're all therapists who work with people every day, and we, as we build rapport and we get to know our patients, we know each of them and how best to engage them and help them understand what we're proposing. Because we all know that it is very difficult to comply with something that you don't understand. And it's a reasonable expectation on the part of the patient that they are given the information that they need to engage with the process and to understand what they're being asked to do. Now, personal input. One of the ways that we engage people is that we allow or facilitate input into the process. Of course, there are decisions that we are going to make because they affect the therapeutic effectiveness, but I can't tell you how many times I have said to people during training and workshops, it doesn't matter how good a garment is, if somebody's not prepared to wear it, it's not worth anything at all. So the more that they can take some ownership of the choices that are being made where it's possible, the more we stack the odds in our favour. And then we're in a position when we can build on patients' understanding of the purpose. There are ways that we can facilitate personal input, and that is taking wider issues into account, their lifestyle, any concerns that they have, maybe requirements or demands from work or school, and also just personal preferences. I'm just going to go back to that concern as an example, because I do recall someone who I worked with for probably the best part of 3 years after a very major burn injury. And he was particularly protective of the tops of his shoulders. He was so anxious putting anything on because he was so fearful that there would be some shearing. And this was happening months down the track, months after he was healed. You know, for me, I would say that it was quite irrational. For him, it didn't matter whether it was rational or not, it was completely overriding. So what we did in that garment was we replaced segments of the garment, just the bit that go basically over the shoulders, with CDA, which is a smoother, more slippery fabric, and it's not sufficiently robust to make a whole garment out of, but that made a huge difference. And he valued that very highly because he was the one who made that choice and had the input into that garment. Comfort. And we just need to remind ourselves that it's the patient's definition of comfort. You know, when we stop and think, we've all got our foibles. Sometimes it's sleeve length that, you know, you put on a t-shirt and it's just a centimetre too short and it's just incredibly preoccupying and uncomfortable. It's exactly the same for our patients when, you know, when they're wearing compression. So ask your patients, you know, what sleeve length feels comfortable? What height do you like to wear your pants? All those sorts of factors. Now, for some reason, I've just seen that my face has come on and I'm sitting in a reasonably dark room, so I do apologise for the distraction. I'm not quite sure how that's happened because it shouldn't be there, but we're just going to roll with this. So the other things that affect comfort are the anchorage. Never end a garment at the widest point of any body part because it's not going to stay up and then it will be a constant irritation. Of course, make sure that the garment is a good fit. You might want to consider ventilation options, like in this image here, you can see there's a mesh gusset. Now, if you need compression directly in that area, that's not an option that's available. but otherwise that's a way to keep people cool and comfortable in their garment. Avoid friction, certainly. So be mindful of where skin is perhaps a bit more friable or areas of peak movement. So watch for those, for joints particularly. And you might want to consider lining. Avoid zips buckling. Now that sounds like a funny thing to say, but sometimes we can get away with a shorter zip rather than a longer zip, because zips, as the zip gets longer, there is more chance of it buckling, and that's not to do with how the garment's made, or it's not to do with the quality of the zip. It's just basic physics, I suppose you could say. So maybe consider zip placement or zip length to avoid that. Protect from cutting in. The classic example, of course, is the anterior ankle, where people can feel quite uncomfortable right in that anterior ankle crease. But if you put in an anterior ankle gusset, an insert, then you take that pressure off that direct point. And of course, consider linings for comfort. Functional impact, obviously this is significant, but minimise restriction to joint range and minimise the number of joints longitudinally in a garment. For example, if you have, say, a toe glove that is attached to a waist-high tights, you have got the hips, the knees, the ankles and the toes all in that one garment. So when, let's say, someone was to squat in that garment, they're going to be feeling the garment pulling down over the bottom. They're going to feel friction over the knees. It might cut in around the ankles, and they're going to feel downward pressure on the toes. So that restricts movement without question, and is uncomfortable. So in that sort of instance, you might be better off segmenting the garment. For example, leggings with toe glove anklets, or perhaps open-toed tights with a toe glove underneath. The other thing that affects function significantly, back to good anchorage again. So consider where the garment ends, and you might also consider using silicone-backed elastic so it's less likely to slide down. Again, good fit. Then also considering reinforcement, padding, protection over different areas to improve the comfort and therefore minimise any impact on function. Make sure it's suitable for the work environment. If somebody is in working underground in 54 degrees, don't put them in a fully lined garment, or minimise the amount of Cylon-tex that you're going to put in that sort of environment, and perhaps select power tex because it's a little bit more of an open weave. So that's an example too of the thermal impact we need to consider, particularly in our country where people are living or working in a hot or humid environment. Then work and lifestyle. Well, I've touched on that in those last 2 points in that last slide, but do ask people what their work requirements are. Just as an example, I had a patient who was a chef. He was Asian, and he had hot oil splash up onto his face, and so he had a significant facial burn. And the biggest area that he was burnt was on his forehead. Now, he had been provided with a face mask, but he just refused point blank to wear that to work, which is understandable. And he felt that his boss would never permit that. In fact, he did never ask his boss, but he felt very strongly about that. So what we did was we ended up giving him a wide headband that gave good compression across the forehead, and we lined it with Cylon-tex so that he had the silicone there. It wasn't as good as a face mask, but it ran a pretty close second. He was very happy to wear it, and actually it kind of looked like the sort of headwear that a chef might wear. So he was delighted with that and very happy to wear that. So, I mean, that's an example of work preference as well. Sometimes in hospitality, you know, employers are unwilling to have people wearing brightly coloured garments. They prefer them to be black or white. I've been aware of one child that that I recall, where the child was not permitted to wear their pressure garment unless it was in school colours. So we need to consider those sorts of, they're not peripheral, but those extraneous factors that are not directly obvious. And we want to allow people to balance their work and leisure. I know, I'm aware of lots of patients who, in fact, rather than alternate their days, you know, when we say one to wear, one to wash, they actually have a work garment and a out of work garment. And I think, you know, we would all have instances where people like to keep their better one for going out rather than at work. So consider lifestyle preferences. You know, for example, if people wear thongs, then we need to have the conversation, do you want open toe or closed toe, or would you prefer a thong toe, depending on what the requirements are of the garment, so they can wear the shoes that they normally wear. And with gloves, open tip versus closed tip versus the electroconductive tip. You may or may not be aware that we have electroconductive fabric that can be stitched on to the pad of the gloves, so that people can use their smartphones. And if they really need a closed tip glove, putting the electroconductive tip can be the difference between people being willing to wear the glove or not, or constantly taking it off and then just leaving it off. Then donning and doffing, and this intersects obviously with toileting. Sometimes we're better off to segment the garment. For example, we could say do capri pants with knee-high socks for people that find, you know, waist-high tights just too unwieldy. Or maybe you choose not to segment the garment, because it's easier to get it on and off that way. These are the discussions you need to have with your patient. You can consider side tabs. Now, what's a side tab? It's when we actually put a tab in the elastic, say, for example, on the waistband, so that there is a little bit, if there's a zip, obviously the Velcro tab and the elastic going sideways is a helpful thing. But sometimes we choose to put a side tab on just because it's a little bit more adjustable. We need to have the discussion about whether we put in a zip or don't put in a zip. And I'm just going to slip away because the dog is going to be scratching on the door. Bear with me just a sec. Apologies for that, but the noise would have increased. So going back to zips or no zips, you might want to check out the webinar that we did last month, which was the discussion about whether you put in a zip or whether you don't, because that's not always a straightforward question. So you can check that out on YouTube. The other thing to consider is open versus closed crotch. Now, just be mindful if you are considering an open crotch garment, there are some inherent discomforts that go with that. People find that it sort of, you know, cuts in around their bottom, or maybe sits a little bit too low on their thighs, or if there is any edema involved, you will get when it's an open crotch garment, that's almost like an outlet for the swelling, so you can get some pubic edema. So consider all those things. And then, of course, you need to consider whether someone is taking the garment on or off with or without assistance. And actually, just a quick little aside while I think of it, we do find if you do need to use a donning aid, the best donning aid is the Sigvaris, I think it's called something like a collar and cuff, but it's a rolling gel, almost like a cushion that enables you to, it helps obviously to don or doff the garment, in fact does both, but it doesn't cause any trauma to the power net, whereas some of the donning aids like Easy As can damage the garment. If you want some more information about that, we can let you know that. And then finally, choice, colour and style. One of the great assets of Jobskin is the range of colours. That can at times be slightly problematic if people are not happy with their colour choice when it arrives, but that's a really rare occasion, and I think it's a great way that we can empower patients with choice so that they feel that they are having input when, you know, for some garments the options for them to have input to are very limited. So colours, there's a range of fabric colours, there's a range of thread colours, and we also have rainbow thread where you choose 2 colours of thread and they're stitched together, and it has a really fabulous effect, you know, like a unicorn, look like unicorn colours or contrast colours. It totally looks gorgeous. It's quite a fantastical sort of option. Garments can be made in footy colours or in skin colours or to reflect cultural pride. At the last couple of hand therapy conferences, we've had this garment on display, and I was just so disappointed I couldn't find a good photo of it, that was made in with black and red fabric and yellow stitching for Indigenous Australians, and you know, it can be made in, you know, flag colours, or of course it doesn't have to be Australia, it can be where anyone's origin, but that's a great way to engage someone in their garment. The choice of style, and like this, I love this image of this particular garment that was made because it looks like activewear. Nobody looking at that, their first thought would be, oh, why are they wearing that garment? And it's small things like that that can make people far more comfortable in wearing their pressure garments. You have the choice whether to add lace or not to have lace, say on over bra cups. And then for children, there's motifs, they can have motifs, or again, the whole colour contrast thing is wonderful. Like a small child can have their suit made in Spider-Man colours, or I don't know, Catwoman colours, or you know, in just like little fantastical little things like, you know, fairy pink outfits, or again, footy colours. So whatever is going to engage a child and offload the parent. So that's our kind of brief discussion about strategies that you can use just in the everyday when you are prescribing your garments. Most of you would be aware of this, but how do you prescribe and order a garment? You use our order form cover sheet plus the relevant measuring form. If you're measuring for a glove, you use a glove measuring form. If you're measuring for tights, you use the waist high measuring form. Those queries can be directed to customer service at jobskin.com, but that's where your orders go, and their phone number, the Australian phone number, is 0399158000. I realise that I keep forgetting to add in the New Zealand one. Apologies, I'll get Veronica to send that through to me. And for support, honestly, we have an ever-expanding library at jobskin.com and on the Jobskin YouTube channel. So take some time to have a look at what's there, and there's all the measuring videos, the measuring tips and tricks, and all our webinars are all there for you to access. Veronica and I are here to assist you, often best reached by email. And then, of course, the design team are an incredibly wonderful resource that we have on the Jobskin team. So we've got time for questions. I think if Veronica's happy to take any questions today. If not, if you don't have any questions now, then by all means pop them in the chat group, and we will get back to you with those answers. Thank you very much for joining us.
All right, guys. Any questions? Pretty straightforward? Yeah, good. Helps you know you're on the right track though, right?
Thank you very much.
You're really, really welcome. Good. So as Rose said, I highly recommend popping over to our website and looking under our resources tab, or popping over to our YouTube channel, which is Jobskin ANZ, because there is just a growing resource library in there. Everything we record, so that you can go back and watch it at any time you want. So you never have to feel like you've learned something a long time ago and you've forgotten what it was, because you can now go back and refresh yourself. Awesome. Well, you're really welcome, guys. If nobody's got any questions, then I am going to let you go for the day for wine and cheese o'clock.
No worries. Thank you.
Bye, team.
Thank you.